Welcome back to Bridging Healthcare Gaps. I think today I'm very happy to invite Boyd Lowry from FirstLight Home Care. And this is whole different aspect in healthcare we are talking about. So, Boyd, how are you?
I'm doing pretty well, Tyler.
All right, good. So I think for listener who never heard about FirstLight, could you let us know what do you do?
Sure, Tyler, and thanks for inviting me to the podcast and to share my story. What I do is provide home care for the seniors and match a caregiver with a loved one. So it's kind of like a job description and a is a care plan and a employer with employee. We now have caregivers and loved ones with a care description or a care plan, and we're building all those aspects of that so that seniors, in usually in their 80s and above, but we get all other ages as well, are looking for to stay at home and to live out their time in the comfort of the familiar space that they've lived most of their lives in. And we're matching a caregiver with that loved one and working with the family members so that they understand that they know that they've got the best agency and someone who's really a team of people that are ready to help and support that family and connect with their loved one, their parent or someone in their family or husband usually.
Okay. So tell us about a little bit about yourself. What leads you to become the owner of this home care business?
Well, my life has been full of ups and downs, so lots of adventures and things like that. I served in the Marines, and my father's a minister, my mother's a nurse. I studied human resources and worked in recruiting for 10 years, and then traveled the world fixing industrial printers and solving problems. So, but the initial part, working with mm, um, um, just in service work is usually what I say. In service, I care for the seniors. And that's how I was brought up. That's how what's important to me, faith and service. And then human resources is a component of what you're doing because you're finding people and matching them. Um, and then you're building that description to make that piece work. So this was a natural fit for me. And even my wife was was supportive when I was looking at different franchises because First Light is a franchise. And I wanted to run a business. I didn't want to invent a business. I'd already done that. And, I wanted to work with people. And here I work with people every day. And I work with a lot of different types of issues with families, either going through a loss of a loved one, dementia, Parkinson's, Lewy body, um, Alzheimer's, and how these things fit together. And that's kind of where we found a nice fit at First Light for that solution.
Very good. I think that home care, as far as I know, is a lot of tedious jobs and tasks. And if you don't have that kind of mind to helping them, I think that will make your job very difficult. So I think you and your team members have the same mindset helping them. I think that's the very important start, and so that you can helping people not just because of the job. I think that's very critical. Uh, so you mentioned about care plan. Okay, I think that's very important. I think that's the differentiation from your company. Tell us about more about care plan when you enroll a senior, for example. How? tell what's the detailed process to make sure this senior will be taken care of?
Well, in New Jersey, we are a licensure state, so we are required to do assessments and all this of the loved one early on, and that is the foundation of what's going on. First thing is you talk with the family, you figure out what the interests are, just like you would recruit with someone, and then you're figuring out what their interests are and then their needs. So if they've fallen and ended up in rehab, now when they come home, you want to know what their acuity level is. And that goes into the nursing assessment, the phone conversation, the initial phone conversation, and that creates, from there, you create the care plan. And the care plan would be like the job description. So that is what the caregiver is going to read off of and follow their duties and tasks accordingly. And they have that on an app when they're doing care and they follow those things and check those off. And that's compliance. So all these things have to go together to meet those. So building that care plan is critical because that's the instruction sheet. And when a caregiver sits there and says, "Oh, I don't know what to do," you then can say, "Of course you know what to do. You have a care plan. You right in front of you." And
Yeah.
you can open your phone and you'll see the tasks and you've approved those tasks and you know what the duties are. And the duties in home care are not necessarily what a lot of people think they are because they just think, "Oh, somebody's going to come there and sit with my loved one." No, that person does activities of daily living and all the things that you and I take for granted, the things that we just do regularly every day, doing the laundry, folding the laundry, pulling the sheets off the bed, putting the bed back together, making the a meal, structuring the steps to make a dinner, putting the dishes away, cleaning them. Those are all tasks that as we get older get harder to do to organize. And with dementia, now you even are farther along and you need more oversight. And that's where a caregiver comes in and just is available to do those. And then of course on the higher level side, you're still transferring and positioning, incontinence, dressing, showering, eating, toileting. So those are all things that the caregivers are able to do, and those are the tasks that they're looking at their care plan and then administering.
So li- caregiver you provide from your company to seniors, it like it will be like 24/7, or they say, okay, that's certain hours a day they go there. How does that work? Or depends on the care plan.
It depends on how you've structured the care and how the client wants and can afford care.
Okay.
So a lot of times we're dealing with a pool of money that it might be limited, or they might have some sources coming from a long-term care or a veteran services that you want to work with, but it's only so much. So you're going to structure the care either as a starting out 3 days a week, 4-hour shifts, or 5 days a week, 8-hour shifts, or 7 days a week, 12-hour shifts, or overnights if the person is up all night, or they're wandering during the days, 24-hour shifts. And then if it gets to 24/7 hourly, now it's not so cost effective, so we use live-in to kind of reduce that cost and manage those funds, and in a way that we're not burdening the family. But it also allows us to be competitive with nursing homes and other facilities because they're now in their own home and they have their memories and their places where they feel most comfortable and most independent and they're getting the care and able to live independently still. And and then we just figure out the hours that fit based off of their availability and their need.
Okay.
The
So
availability of funds, that is. So
okay, when you talk about the funds, so they are majority coming from their health plan, is that?
Unfortunately, home care is considered non-medical. So
Right.
it is not covered by any insurance companies. Now, there are certain exceptions to that rule, and they try to make that work within the hospitals and things like that. But usually that doesn't work necessarily. So you really have a non-medical caregiver coming in and doing everyday tasks that we all need to do anyway. It's just as we get older, it gets harder. And so we're just bringing somebody in, so it's not covered by insurance. So the only way to get some support is either through a VA, veteran services for somebody who served as a veteran, or someone who has a long-term care insurance that they've invested in. The other ways are going on hospice and or poverty, which is Medicaid.
Medicaid. Okay. Are you saying a lot of your clients actually pay out of pocket?
Yes.
Wow. Okay. All right. So what when you look at the family and seniors you serve today, okay, what the biggest challenge they are facing that lead them to call you
What's the biggest challenge?
for the families and seniors?
So there's a couple reasons why someone would call us. So first off, they might be told they might be in the hospital and the doctor says you need somebody to help your parent uh, with organizing their activities and things like that during the day. They're just not washing, they're not showering enough, they're not changing their clothes. What's going on? And so they need somebody there. Or another reason would be they fell. They fell in the shower. And now they were there overnight and nobody was there. So it'd be nice to have somebody visit regularly. It's because we don't ever want to have a catastrophic event where a loved one is stranded on the floor. That's your life alerts and things like that. That's what you do with those for. Um, and then another is wandering, paranoia. They can't be left alone. And those start going into memory cares. One of the fastest growing areas and needs right now is dementia. Uh, our in our population we are living longer, we are aging well longer, but our bodies are healthy, but our minds are starting to forget. And dementia is has many forms because the brain is made up of so many different things, different parts. It manifests in different ways, and you have to address each one of those ways, and the caregivers have to understand how to manage that situation with whatever type of dementia that the loved one could have paranoia situations, or they could just be wandering, or they just can't remember anyone's names, and they revert back to older phases of their life. And as you look at the stages of dementia, you're trying to manage the last four in home care because that's usually where you need oversight. You need another person to do that. And that's a lot of what our cases are: compassionate memory care and caring for people that are still have their anchors and their memories in their home. They feel most comfortable in their home. They're living well. They have moments of clarity. The family can come and visit them easily, and but they need to have somebody there so they don't wander off, start a fire, fall in the house, and get left. So you want that dementia. So when from a dementia care standpoint, that's a lot of the cases and a lot of the issues you're dealing with.
Right. Okay. So from your point of view as the owner of this home care company, what's the biggest bottleneck for you to grow high quality home care company?
Well, I've been doing this for 14 years now. It is a franchise, and First Light is a very solid, supportive franchise that believes in caring for the caregiver so that they can care for your loved one. We incorporate that into my service work, my idea and belief of giving back and service. So that's faith, ministry, nursing, and then military service. All those are service professions, as well as my wife, who was a teacher for before she retired, and an educator. So when you think of all those types of work, that is what falls mostly into building the best structure for care. And I believe and that's what I believe is our highest value add, because we care. In a world where we're developing all this AI and systems of no longer talking to anyone, we now have an automated person.
Yeah.
We now need people to actually talk to us. So in my company, we'll work hard to utilize AI, but also to give that personal feeling and communication and touch, where we can actually work with you to do the matchmaking, to find the right fit, to do the ongoing oversight, to understand the profile of the loved one, and then do the ongoing responses that you need in order to make sure care is um, at the level that we want, which is more of a personal level. This is our most important person, our parent or our loved one.
Right. Any bottlenecks or big challenge you are facing as a company right now?
Uh, in New Jersey, it's a lot of compliance, a lot of oversight. It's very highly regulated, so we're mandatory licensure, mandatory renewable licenses for the caregivers. We have mandatory accreditation. We have mandatory domestic care worker laws, and they're adding more every year. So we're mandatory 401(k). It's just the compliance is making it very difficult to run a business without being a very large organization. So that personal touch, I think, is harder and harder to do every day. And those are my bottlenecks. Those are my most difficult thing to do what I want to do the way which is to give and to serve. The hardest thing to do is to do that in an environment where um, you've got so much paperwork and over-regulation and oversight that is taking up the time that we want to spend with clients.
I see. So maybe you can use AI tool to do those kind of paperwork.
Absolutely, that's very true. So utilizing components of AI to free up those tasks, to get those tasks that are being regulated and oversight and compliance, that's one of the areas, and to utilize AI in that way for that mundane, repetitive task, and then utilize it through caregivers, software, and all the stuff that software was meant to help us solve. Eventually, I believe that it will get there. It's just right now we're in a very painful phase of transition, and we'll get there maybe, but hopefully.
Yeah.
But yeah, utilizing AI and freeing up the staff to actually do what I want to do and we want to do, our company wants to do, is to be there for our clients.
Right.
That's what our goal is. So that's a goal, but the bottleneck is the regulatory environment that we live in.
So I assume the software or the tool you mentioned for your caregiver do better jobs. I think that's offered from the franchise corporation from the company. They offer this to you, or you guys need to
So
develop that yourself.
So FirstLight gives you a franchise gives you a format. It says, here's the tools that we recommend. These are the ones that this is what we've given as a template. And then we have to take that template and apply it within our local environments. And as similar as you keep those from state to state, that's great, but every state's got a little different thing. So sometimes you have to use different software. So they have two recommendations right now, I believe. I use one solid EMR that we have a lot of integration with. But then I bring in an AI company and I evaluated them and I've gone through a couple of them already. So and I utilize that. And then and then you have marketing companies, you have analytic companies, you have hyper local marketing, and then those are usually you're doing at your level. You're trying to find ways of creating uniqueness to set yourself apart because there's so many of us home care companies. So you're trying to find those environments. So the franchise is giving you a structure, they're giving you the main program that they've already vetted, payroll and the EMR. And then the rest we're kind of getting recommendations for, but we can use a little outside support sometimes.
So sounds like they give you kind of guideline, but you can explore the recommendation they give to you, and you can also find better tool locally. You can do that as well.
Absolutely. And when if you take all the states in the union and you say there's only one software for all of them, somebody's going to fall.
Yeah, yeah,
So so they're saying here's our recommendations. You can utilize others in these areas. And marketing is typically more of a local kind of target.
right,
Hyper local is that. Um, Optimization, I believe, is that. And that's a little issue that is hard because franchises control the domains. So that's a little difficult. Um, and but that's something you have to work through. But most of the other things like the AI and then I work on the NAC within our franchise, um, which is one of the governing bodies of our franchise, and I talk about the software that I'm utilizing. Then we have committees, so we have say in how we direct the company over time because home care is evolving regularly. I mean, I think all areas of business are evolving, but I think rapidly right now, home care is one of those spaces, or healthcare in general is just going through so much rapid change. One, because of the cost of everything, but then the tools, the software, the regulation, and then just the world in general. There's so much change all the time. So you're trying to adapt regularly and target things. So, you know, it's actually kind of exciting to me. I like change. So, but at the same time, it can be a little too much.
yeah, yeah, definitely. The the AI agent, I think that's can help you a lot if you deploy the right AI agents. That's the
Yeah.
agentic. They can do a lot of work
Yeah.
autonomously. That's I think that's probably the solution for you.
Yes. Yes, Tyler. I agree with you very much. I mean, I'm pretty much an early adopter. So I am utilizing that in a lot of my areas and trying to figure out how to expand it and talking to other owners about how I utilize it in order to create transition within our group. So because I believe that, like you just said, it is a tool that can be used. You just have to use it correctly. But we need input because AI is all about data. So the more the data, the better the tool, but also the more input, the better you select the right vendor.
Right.
And then, and that goes back to my traveling and other businesses. And, that's just business. I've always enjoyed how business works and
Yeah.
understanding that.
Right. Okay. So we have a lot of listeners. They are uh, practice doctors. So you position yourself as a partner, help doctors to refer their elderly patients with confidence. So tell us about that.
Um,
how do you work with them, and how do you make
Oh,
sure that they are comfortable refer elderly patient to you?
so one thing with us is that you, I mean, I work with care managers, I work with doctors, they give a referral, we do we get we partner with a healthcare services company that does the assessments, that does the call and the communication to get the correct prescriptions and medical background. And then we structure that with our nursing visits to maintain the care plan so that they're in line with the care because something can change from month to month. So we do phone calls and repeat visits and care monitoring and all those things. So from a doctor's perspective, they want to know that once they hand them off to me, that they're going to get the best care and attentive care, and then there can be some follow-up if they want to stay in touch with that piece that we can communicate that. So we integrate that into our care. We need it to be a two-way street as well. Um, and then from the hospitals, they're usually going to the rehabs and then handing off, and it's the families that we're integrating with. So they need to know that we're actually going to be able to handle the cases and follow through. So those are also doctors in there, but a lot of times it's nurses and social workers who are delegating the jobs. And then if there's specific things, sometimes there's a catheter, an ostomy situation. You know, that's where a doctor would want to know a little more detail. So we're here to communicate. We're here to partner. Sometimes a care manager is needed. We'll partner with that. And then we create our own dialogue documentation, and we can actually use AI for that. It's another thing for transcribing. I think a lot of that's going on right now. You're seeing that there's more note transcription. So if they need that kind of highlight of tasks, then it has to do HIPAA because it has to be HIPAA compliant and secured, which our environment is. And when you're going with a corporation like mine, you're protected. The data is protected. It's healthcare records. It all has to be within a secure environment, secure tools, and everything. So they know it's secure. They know that we're going to go on doing ongoing care. They know that they can call us and communicate with us if they need additional information about care as it's going on and follow up.
Do you normally communicate with doctors
The, the,
for their status on their seniors patients if they refer to you?
if someone is going back and forth, you're usually dealing with the family member. They're usually dealing with the family member, and the family member is talking with a doctor, but sometimes there's a care manager in the middle. But initially, we start with a nurse's assessment, where they're getting the details from the doctor at that point that has given a prescription, and that prescription is building out the needs. So that's where you're communicating initially. And like I said, if you want ongoing, we can communicate that with follow-up assessments and care monitoring. So if they actually wanted to know, because sometimes, doctors are busy too. So
Yeah.
they really want to know that their client is taken care of. So so if they pass their patient on to us, we're going to do everything we can to service them. If they want to stay in the loop or they want to be, and they're a usually once you get in that age, you're really looking at a geriatric care doctor. Uh, um, and those are the people that usually want to stay in touch with certain things because sometimes you have to manage the medication because over time, you might have to actually readmit them to a mental health place location because they need to manage the meds, and that can only be done in a period of time under observation. So I would want to work with the doctor to get that to get that allowance recommendation and then get that in. So that might be how we build that in. And then then that way the doctor can actually get them to the right facility. The facility will manage the meds over a couple of weeks, figure out how to tweak it if it's dementia and paranoia or Parkinson's or Alzheimer's. and then they can come back home. So that's a common situation where you would have probably more of a back and forth a little bit.
Right. Okay, I see. All right, we are running short on time, but last questions for you, Boyd, is like, what's your short-term goal, say 6 months or a year, and what you trying to, and for longer term, like 3 years after, what do you see yourself in longer term?
Uh, well, I have in New Jersey in Bergen County where I service the seniors. I want to build a company that is reputable, strong, and in service to others. So I do everything in order to give back and to serve. So that my vision is one of service, and that's how I've built my life and my business and partnered with my franchise. Um, so, as I said, my father's a minister, my mother's a nurse. I served in the Marines, and in service, I care for those, whether it's in education and awareness, whether I go and do visits and build a plan. I want them to feel safe, to feel comfortable, to give back, and to serve.
Good, good. I like that. That's the your mission and vision. That's very clear to serve with that kind of mindset. All right, boys, thanks for your time today. And for the listener, I think if you have any questions or comments, feel free if you want to ask Boyd any question about home care, and feel free to leave your comment and questions in this video below. So, Boyd, thanks again for your time today, and it's a lot of insightful information about home care.
Thank you, Tyler. Thank you for having me.
All right, take care now. Bye.
Bye bye.